guys, I'm going to make a quick little video here talking about an introduction to some basic humidity devices or ways to provide humidification. And really we're just going to focus on bubblers here for this particular video, okay? So I'm going to show you a lot of times at the hospital as you start getting somebody that's receiving nasal cannula flow, generally above about 4 liters a minute is where we kind of start thinking about employing a little bit of humidification, because you keep in mind all that gas coming out of the wall, 100% dry, okay, so you start to get a little bit of irritation in your nares and things like that. Not saying people are gonna not ask you when they're on a 2-liter cannula or smaller. In the kids world you might have somebody asking for a bubbler on much lower flows, but as a respiratory therapist, as you start going above 4, if you have the ability, you can think about providing a little bit of humidification, okay? These devices don't provide a significant amount of humidity, but they're gonna add a little bit into the system. Okay, so generally speaking, most of our bubblers at the hospital, and I get some of the packaging labels and stuff taken off this for practicum purposes and things, usually it comes with a pre-filled, like a 500 milliliter bottle of sterile water. Okay, this would be all packaged. It's going to have 2 little plastic pull tabs, okay, that keep this thing sealed up until you're ready for use. So when you get a brand new one, you pop a little pull tab off here, pop a pull tab off here, and it gives you this threaded connection to hook up to the top after you pop that little connector off, okay, and that gives us that dis adapter to thread onto a flow meter here, okay. So all these things, as we start getting and threading things onto a flow meter, all right, or even threading things onto other things like this, keep in mind these are all made out of plastic, and plastic isn't like you're threading something metal on there. If you don't have everything seated correctly and you try and force something on there, you can very easily strip the things out and make it where you can't get a good seal, and it makes your life a little more difficult. So as you can see, I'm going to have to remove this particular Christmas tree adapter if I was going to put it on right here. One thing I'll tell you is if I have a patient that is on a bubbler, especially if they're getting some sort of other therapy where I'm using a flow meter frequently, it can kind of be problematic if you're having to take somebody's bubbler off and put a Christmas tree on to give them a nebulizer, disrupt their oxygen flow. So I do like to utilize a Y adapter right here, okay, high pressure Y. That way I can have 2 flow meters. So I can go ahead and have my bubbler and my oxygen device threaded on one side, and then I have another flow meter set up with a Christmas tree adapter, and any other time for any other sort of devices, or it could even be if for whatever reason they're in ICU or something, have a resuscitator or something along those lines. Now, just like with everything, okay, this thing is threading on. If you're laying on your back looking up at it, it's going to turn clockwise to tighten, counterclockwise to loosen. Just needs to be finger tight, okay? Everything needs to be nice and snug as you're attaching that to the bottle. Now, I was able to thread that on pretty easily here. Sometimes you'll see it's not going well, you can't get it, and once again, you're worried about stripping it out. If I'm ever having any trouble, I just go ahead and pop the entire flow meter out of the wall. I hold this piece, and I find better luck kind of threading this flow meter onto the bottle itself, and then kind of popping everything into the wall. Now, so once again, whenever we're using this bottle, okay, not saying you can't use it at liter flows, less than 4. It's not that effective. As we start going up above 4, that's where we really start thinking about this. I want to be clear because students make this, kind of assumption a lot. Just because we're recommending considering a bubbler above 4 doesn't mean you can't go up to 4 liter, 5 liter, 6 liter nasal cannula without one, okay? I've worked at facilities that don't even use bubblers anymore because there's not a lot of effectiveness, okay? It's adding a very, very small amount of humidity to that air they're breathing in. So if you have them, especially if a patient's kind of complaining or something like that, by all means, go ahead and consider utilizing that. And when you think about this bubbler, as I turn on the flow, I kind of turn this sideways, it's ultimately just shooting a gas stream down to the bottom of this little water chamber. It's making contact as that oxygen is bubbling through this particular surface here, or up to the surface here, okay? And we're adding on a little bit of humidity into that gas. Remember, humidity is invisible. It's not creating an aerosol, and that's a good thing. We don't want to create an aerosol with this device because we're using small bore O2 tubing with the nasal cannula. And really, this device is only for the cannula. We're not using this for simple mask. We don't put it on a Venturi. We don't put it on a non-rebreather. Okay, this is really just for nasal O2. If we have too much flow going through these things, a couple of things happen. And one of them is we're worried about those little water droplets getting into the tubing, all right, and creating condensate or little water drops inside of this, and it can be a bad thing. It'll block this up and cause issues. Now, it's important that when we set this bubbler up and we have connections, okay, that we make sure we don't have any leaks. So there's a particular safety feature that's built in on these bubblers that is going to let us know if we have a leak after setting it up, but also allows us to check our work and make sure that there's no leaks in any of our connections we've made. So if you're adding on a bunch of extension tubing, you can do this as well. All right, because every place you make a connector, you're worried about the potential for a leak and that patient not actually receiving the gas that we're setting here. Okay, so you can see the higher I flow this, the more that it begins to bubble. Now this is a plastic container. If I had some sort of an obstruction in the system, remember this flow meter is fueled by 50 psi. Okay, you can see this thing expanding, it's shooting water up on the top and everything like that. That lets me know, okay, if I walk into a room and this thing is whistling and my patient's desaturating, it lets me know that there's probably a kink in the line somewhere and they're actually not receiving the liter flow that I have set. Okay, likewise, let's say I'm hooking a bunch of stuff up here. And I wanted to make sure my connection's good, okay, and I'd use a gloved finger. I could have a bunch of extension tubing or something like that. I can go ahead and include this, all right, and I should have the same thing happen. So if you're on a lower liter flow, I will say it takes quite a bit of time. So if you've got somebody on a 3-liter cannula that asks for a bubbler and you got 4 different pieces of extension tubing, okay, and you want to check it, it's going to take a long time to build that pressure up, so I'll turn up the flow a little bit, okay, but you don't have to. That lets you know, so if you're checking your work, it lets you know if you have all your connections intact, okay, and no leaks or anything. But if you show up into a patient room and you're wondering what's going on, you hear that noise, start checking that tubing. They're not receiving what you have set, and that could be what's responsible for any sort of O2 desaturation or anything like that. Now, because this tubing is pretty small, as you're getting close to 6, it's not as evident, but you can see there's a little bit of pressure building inside of that bottle, okay? I know your book could tell you that you can take these things up almost to like 10 liters, that sometimes we don't, okay? Really, there's a very narrow window that we're utilizing a regular O2 bubbler for. Once again, just for a cannula, and really start considering it above 4. Once again, you can go a little bit lower on the flow if somebody's complaining of nasal dryness or something like that. But as we start getting close to that 6 point, we get worried about there being too much back pressure with this device and making subtle little squealing noises and then not truly receiving the flow. Okay, so very, very narrow window of liter flows that we're working with this. Now, I know the standard liter flow for a standard nasal cannula we teach is 6 liters a minute, okay? And it's not that you can't crank it any higher, it's just that we know it's nowhere near providing all the inspiratory flow demands a patient has, okay? And there's nowhere else to house that, so we're worried how much FiO2 do they really get in. You might run into a brick wall and not get further FiO2 increases at the alveolar level, okay, as you crank that liter flow up. Now, I'm gonna go ahead and I'm gonna turn this off here. Talked about hooking this up and troubleshooting. Let's talk a little bit about this high flow cannula, okay? It's not a true high flow in the sense that we think about it as respiratory therapists, because it's not really meeting or exceeding a patient's inspiratory flow demands, and it actually comes nowhere near even being close for a lot of patients. But we call these a high flow setup a lot of times, and unlike a regular nasal cannula, okay, I'm gonna kind of show you a regular cannula here. You can see kind of small bore tubing, even smaller than the O2 tubing right here, not really as wide and thick. These greenish nasal cannulas that come with like a high flow setup, you can see it's just a little bit bigger bore, okay? You got a little bit bigger of a chamber right here as it goes into the nares. You can see the green tubing. This green tubing itself isn't any larger in diameter, really, it's about the same size, okay? So if you have a patient, our goal is to not have you on a mask, okay? I wouldn't want to be on a mask because you can't eat or drink, it's uncomfortable and everything. So sometimes if we got somebody with a significant oxygen requirement, but they're stable, they're moving in the right direction, our goal can sometimes be to try and get them off of a mask and provide nasal oxygen, okay? And that's where these things can kind of come into play. So these high flow setups, really, we can crank you up to 12, 10, 13, 14, 15 liters a minute, as much as you tolerate. And we're just using pulse oximetry. We don't know how much FiO2 you're getting or anything, but we're trying to make a transition from a mask back over to these cannulas for a patient, give them a little bit more freedom and independence and things like that. Now, the problem would be if I were to run this with a standard bubbler, okay, because you do want to provide humidification, even though these bubblers aren't overly effective or anything like that. They're adding on something, okay? And as you start getting up on higher flows, we're worried about that drying out their, mucociliary escalator, their nares, being uncomfortable and things. We want to provide humidification, and if we're using that regular bubbler, as you start getting close to that 6, you're going to start getting into issues with back pressure and running into some problems with that pressure pop off, okay? So let me fill up I'm going to show you a high flow bubbler, okay? Or very often these are sold together. We're going to talk about some differences with this and kind of show you a couple of different little things here, okay? Let me fill this with water. I'm going to pause this video real quick. Okay, so I'm back with my little high flow bubbler here, okay? So this is nothing more than a bubbler. People give it more credit than probably what it deserves. When you think about some of the things that you learn about in your lecture side of things, as far as efficacy of humidifiers, really the surface time and area, surface contact and the area and contact time and all these different things are going to make a humidifier more or less effective. We don't heat these. Once again, we're worried about condensate, even though heating is what makes a humidifier probably the most effective. That temperature high flow bubbler. These do not come pre-filled. We fill this with sterile water, whereas they're pre-filled, and once you need another one, we just throw it away and get another. Okay, so because of that higher column of water, it's a little bit more effective. It has, instead of a 2 psi pop off, it's got a 6 psi pop off, and it tells you this picks up where the bubbler leaves off. So if a bubbler leaves off and we start considering something else, as we go past 6 liters a minute, okay, if you're using something like a high flow cannula for a patient, that little bit bigger bore tubing, you could do something like this, and this one goes 6 to 15. Because it's got that higher pressure pop off, okay, we don't run into as many issues with too much back pressure being generated and then not getting the liter flow. Okay, it doesn't make as distinctive a squeal, and as you might have been able to see on that bottle or when you're looking at it in the lab, we have a minimum and max fill line. Okay, you don't want this thing to see. I can keep cranking this thing up, and you can see how it starts to violently kind of bubble there. As I start, right now I'm at about 10 liters. Okay, hang on, I got a tangle on my line here. So if you had this thing filled up too much, it could bubble. Your patient's not going to like you very much, okay? So you can see it's bubbling pretty violently. As I start getting up to 15, I don't have any of that squealing or anything, but you can see that water's bubbling pretty vigorously, all right? Still not high flow from our standards or anything, but it could potentially provide a little bit more FiO2 than what a standard cannula could, okay? Even as we start cranking up that liter flow, once again, our goal would be using pulse oximetry, and you might have somebody on 8, 10, 12, 14, 15 liters or something like that. And if you're having trouble maintaining your saturations, maybe they're just not ready for this. But once again, it's really just a means of utilizing a device in a different manner to get them off of an oxygen mask. So I'll kind of show you, this thing does have a pop-off, but it's 3 times the size of a regular, and it's not as distinctive a squeal. So you can hear like just air hissing. You really got to be paying closer attention in order to catch on to see if you got that obstruction here. It doesn't make that squealing noise, but I can very distinctly hear air coming out, and it's coming out from right at this little spot at the top right here, okay? So this is the high flow setup for nasal cannula. Once again, nothing overly fancy, not truly high flow like an OptiFlow and some of the things we'll get into. Just utilizes a little bit of a bigger bore tubing and a higher flow bubbler. Once again, these bubblers are just for nasal cannula. Okay, we don't use them for simple mask maturities, nothing like that. You got to look at some other devices if you're trying to provide oxygen via a oxygen, humidity, and or aerosols via a mask. and we'll get into that stuff in a separate video here. Just wanted to kind of show you this basic little setup. All right, one other thing I will tell you about is if you had 2 flow meters in the room but you did not have a Y, one thing that people would do a lot of times is pop out this flow meter, okay, if I didn't have a Y here. So they can hook up and run a nebulizer, and they'll set your flow meter with a bubbler on the bed, and these things that tilt upside down sometimes. All right, I'll kind of show you what can happen here. So let's say I tip this upside down accidentally, I didn't realize. I'm going to turn this flow off so I can show you what happens. You're just finished giving somebody a nebulizer treatment, you got water in the tubing, you're not aware. Kind of point this away from the camera. Sometimes they'll start coughing and having a lot of issues. It's embarrassing when this happens, and it's happened to the best of us, okay? But what I'm warning you about right now is if you pop that patient's bubbler off and you got a flow meter set on there, okay, and you leave that cannula hooked up, you need to be very diligent to make sure you don't get any water in that tubing. If you get water in that tubing, ideally get in another cannula, okay, because I'm worried about condensation or any sort of water droplets sitting inside of that thing for a prolonged period of time. But you don't want to just shoot a big stream of water into these people's nares that are already compromised and having trouble and everything like that, okay? So I've done it with a little bit of advice. Hopefully you won't do it, okay? But that kind of concludes a basic introduction to these bubble humidifiers, and I hope that helps.